Hello everyone. Good evening, respected doctors. I am Dr. Saurabh Sen, instructor in tomorrow's emergency medicine and critical care. I want to welcome all of you in the emerging world of emergency medicine and today's live Zoom session. Next. Today, we are the team of tomorrow's emergency medicine and critical care is here to give you the concept of emergency medicine and the future of it in UK and as well as in abroad, syllabus of MRCM primary, intermediate and OSCE exam, taking a core preparation with the help of tomorrow's emergency medicine and critical care. All about the RCM account opening and Pearson VUE system for exam, getting GMC registration and MTI Pathways and so on. So before start of this session, I want to request all of you, if you have any queries, please let us know in our chat box. We will answer all of those questions before ending of this session. So now I want to share this platform with Dr. Asif Ur Rahman, the lead instructor and founder of tomorrow's emergency medicine and critical care. Dr. Asif, sir.
Thank you all. Thank you, Dr. Saurabh. So I'm Dr. Asif Ur Rahman. I'm the founder and lead instructor of this institute, the Tomorrow's Emergency Medicine and Critical Care. I have completed my MRCEM in the year of 2021 June, and I've completed my graduation from Sir Suleiman Medical College, post-graduation diploma in anesthesia from Dhaka Medical, and then MCPS and fellowship in pain medicine from Dehradun, India. I have also completed 4 years course training in internal medicine. Someone is talking, please. Okay. So now I'm working as a consultant in National Institute of Neuroscience, and I served as a specialist of critical care medicine in Apollo Hospitals, Dhaka. Next. So today, this is my certificate, the most prestigious certificate from the Royal College of Emergency Medicine.
Sir, come on,
okay. Fine. Thank you very much. Fine. Okay. I'm requesting all of you to mute yourself. Okay, so the session started. Dr. Sanjida, please mute all. Hello. So first of all, next slide. So first of all, what is emergency medicine? Okay, so it's a common question. Actually, what is emergency medicine? What's the role of an emergency medicine physician? So it's a super specialty or specialty subject which actually deals with acute illness or even injuries, which requires immediate medical attention, intervention. Okay, so these emergency physicians, they are specialized in providing care for unscheduled and undifferentiated patients of all age. That means we guys actually deal with acute illness, even it may be injuries, it may be traumas, it may be a case of sepsis, burn. So any sorts of, it may be chest pain, it may be poisoning, it may be stroke. So these are the subjects, or gynae, obs, ortho. So any acute illness or injuries. So when it requires immediate medical attention, the emergency medicine physicians plays the role. Okay. Okay. So here, next slide. So here you see it's Sheffield Children's NHS Foundation Trust. So you see here this ambulance. So if a patient comes, so first of all, these are the steps how we take care of a patient. Just a diagrammatic figure. If the patient came to the ambulance, so after assessment, then handover. Okay. Then in the resus room, the treatment started. Okay, if it's a major injury, okay, then we can shift the patient to the critical care department or to the intensive care department, or even back if the patient walks. So he checked in the emergency. So we give the priority. Initially, the nurse will assess the emergency or urgency of the patient based on the injury or the illness. Okay, so here we give the priority regarding the depth and of acute illness. So based on the urgency. So if it's minor injury, we can discharge, or even if it's minor injury, we can admit the patient in specialized unit. So this is the flow. Say for example, next slide. Say for example, so emergency medicine, you see there are lots of diagrams here. Someone is giving CPR, someone is giving defibrillators or shock, someone is dealing with invasive lines. So these are the common scenario in ED. So it's a super specialty subject, and any patient of acute illness or trauma or other any source of emergencies. So first of all, he should came to the emergency, and here we play the major role. Your paper, we play the major role. How we play the major role? Say, for example, a patient came to you, and as an emergency physician, you found that this patient is in gasping breathing. That means his respiratory pattern, respiratory rate, arterial blood gas is showing severe hypoxemia, even type 1 or type 2 failure. So as an emergency physician, what we have to do? We have to check all the parameters, and we have to secure the airway. So if intubation needed, if mechanical ventilator support needed, you have to do all of these things yourself. Got my point? So you have to intubate the patient. So initially, what we do in our country, or even in other countries of the world, we have to wait for the anesthesiologist. We give a call. Hello, doctor. Critical patient. Please calm down. He tells us, yes, I'm busy with another patient. So this is the potential time, and within this time, usually we lose our patient. So as emergency physician, we should not wait. We have to intubate this patient. We have to connect the patient with mechanical ventilators. Say, for example, in the second picture, you see that a chest drain is inserted. Okay. So say, for example, again, a patient with polytrauma like flare chest injury, massive hemothorax, pneumothorax, a patient came to you. So what we do usually we give call to the cardiothoracic surgeons. Say, for example, he's in the home. He's telling, yes, I just after dinner, I'm coming. Okay, let the ambulance to become. So the time is very important here. So as an emergency physician, you should not wait. After X-ray, if you thought that, yes, this is the pneumothorax, just go for needle paracentesis followed by chest drain. So here we perform the chest drain also. So I'm just giving the scenarios. Say, for example, another patient, look at the third figure, a patient with severe chest pain, and the ECG, say, for example, it's showing VT or VF, pulses, VT or VF. Usually what we do, we just look at, we call the cardiologist. No, we have to follow the standard ACLS protocol. We have to give CPR, even needed, give shock. Got my point? So these all are the activities of an emergency physician. Okay, next slide. Here there are lots of cases. So again, a burn patient, a patient with sepsis, what we do initially in Bangladesh or other countries of the world. Okay, any patient came to our department, we just see, yes, temperature, blah, blah, blah. If the patient is critical, we shift the patient to the intensive care. So these processes are time consuming. No, if you think that his SOFA score or Q-SOFA score is high, patient is in sepsis, start the sepsis bundle in your department, that means in the emergency department. So don't waste your time. So this is the vital and most important department any hospital. You got my point. So don't think that emergency medicine physicians are here just to give some stitches. So these are totally wrong concept. Okay, and the emergency medicine is the further of any further critical care management. Okay, say for example, here this picture in the right upper side, this is a patient of acute intoxication. So start antidote from your department. Patient has taken 40 or 60 paracetamol. Okay, so his INR is high, or signs symptoms are showing that yes, acute intoxication, just start anesthesia assisting in your department. Got my point? Another figure is here's a burn patient, secure the airway, start burn management. Fracture patients, okay, if needed, give some back slabs. If needed, reduction needed, start reductions. So lots of things here. We deal with lots of things. So it doesn't mean that only defibrillator, only no. An emergency physician is an expert who can deal with, who has the compatibility to deal with any acute illness or any emergency situation. He has the capability to handle. Okay. Okay. So next slide. So if you have any question, just put your questions in our chat box. I will say, for example, these are the sorts of fractures. A patient with ankle dislocation, Cooley's, Barton's, Montezia, Galeazzi, lots of fractures here. So after seeing, yes, this is a fracture, say, for example, in the right upper side, it's a case of acute abdomen. So you have to diagnose, yes, this is a case of perforation. Initial stabilization in your department, followed by referral to the specialist department. Okay. Another thing, the last lowermost side, this is the case of ARDS. Say, for example, a patient came with severe breathlessness, we perform the chest X-ray from the ARDS. So start the treatment of ARDS from your department. Then shift to the patient to the specialized department, say, for example, intensive care or respiratory medicine. Okay, next slide. So it's common questions. What's the benefit, doctor? Why I will perform? Why I will select my career? Why I will select MRCEM? So MRCEM is a very prestigious membership degree from the Royal College of Emergency Medicine in UK. And after passing MRCEM, there are lots of opportunities. Opportunities. You can't believe how much opportunities here. I'm requesting all of you to please, for God's sake, mute your mic. So lots of opportunities here after passing MRCEM, after giving OET. Okay, so you will get job based on your core training, based on your competency. You will get job in UK, even in ST3, ST4. Even you may get offer as a locum consultant. Okay, so the salary range is too high from the other membership like MRCP, MRCS, because you guys are deal with acute emergencies. So, and MRCEM is accepted is more than 60 countries of the world. Okay, and you will get a handsome salary. Usually it starts from 60K per annum, or it may raise up to 80, 85, even 90. As a locum consultant, you may get 100 to 120 pounds per hour. And you have the potential ability and capability to lead any acute or critical care unit. Okay. Next slide. So is there anyone, Dr. Raiiq, are you there?
Yes, I'm here.
Okay, so I'm very glad to introduce Dr. Raiiq Ridwan. He's a very brilliant doctor. Now he's working as a specialist in United Kingdom. Raiiq, would you please introduce yourself?
Hi, everyone. Good afternoon, actually, from UK time. I work as a ST4 emergency medicine doctor. Well, nearly finished ST4, ST5 in 2 months' time, inshallah. Currently working at Watford General Hospital, just north of London. And I'm probably, I've worked, one of the people who've just worked through. I've never had any breaks in my life. So I've only done emergency medicine for the last 4 years. And yeah, that's it really. I don't know if I've got anything else to add. So in terms of one of the questions that a lot of people will bring up is, what can I do if I do emergency medicine? A lot of people want to do different things in life. They don't just want to do one specialty. And that's fine. And unlike, I don't know, if let's say you become a cardiologist, you can become a specialist in heart failure, you can become a specialist in cardiac devices, you can become a specialist in intervention, so for example, if you become a pediatrician, you can become a pediatric nephrologist, a pediatric gastroenterologist. So a lot of people ask, if I become an emergency physician, what can I do? What else can I do? If I want to have a subspecialty? So there are a lot of options. Officially, as per Royal College of Emergency Medicine, currently there are officially 3 official ways, things that one can do. One can do the easiest, I think, of all of the three is pediatric emergency medicine. Just to be clarify, adding on to Dr. Asif's what he mentioned earlier was, emergency medicine will look after any acute patient, so it looks after children as well. So every emergency physician looks after children. But if you do a subspecialty in pediatric emergency medicine, you have some extra experience in managing children. So you get an extra year, you get an extra title, you get a double specialty in adult and pediatric emergency separately. And if you want, you can do only children as well in a dedicated children's emergency department. There are some around the country in the UK. And that's one. And it's actually a competitive program. You apply at ST4, 5, or 6 for an extra year. Which includes some time in pediatric emergency department, some time in pediatric ICU, and some hospitals, some time in the pediatric general ward as well. Basically pediatric acute medicine as well. But it's competitive. There's about 20 or 30 posts in the UK. It works slightly differently in other countries, but that's how it works in the UK. Is you do an extra year, no extra exams, and that's why it's so popular. It's because no extra exams. You just do MRCEM, FRCEM, and that's about it. And you do an extra year, and that's it. Extra year of training, as long as you're signed off from the training, that's it. The other options, the other two official ones, are pre-hospital emergency medicine. It's a really rapidly evolving specialty. It did not exist even 10, 12 years ago. I mean, it existed, but it did not exist as a separate specialty with separate exams. Now it has got separate exams it's called the Fellowship in Immediate Medical Care, FIMC, which is actually under the Royal College of Surgeons of Edinburgh. The pre-hospital emergency medicine doctors are specialists who will do emergency medicine in an emergency department, but also work with air ambulance and just ambulance service and paramedics. They respond to high acuity patients who need treatment, in the community. They cannot, for example, there has been cases of a traumatic cardiac arrest happening somewhere outside. They will go and actually do the intubation, do the chest drains, if required, do the thoracotomy and do, a cardiac massage, maybe even suture up the heart to prevent bleeding, and, manual cardiac massage until they bring the patient to hospital. Commonly, they respond mostly to trauma, but they do respond to medical patients as well, medically sick patients, especially if they need intubation, especially if they need, support of ionotropes. And they add a lot to medical care. My best example of seeing a pre-hospital patient was I was the resuscitation doctor, and we got an alert that a pre-hospital medical team, so the doctors are bringing someone, and it was a 4-month-old child who had a cardiac arrest at home. They intubated the child in the living room and then brought them, into the emergency department. Obviously, if you think from a cardiac arrest point of view, every minute that the brain is starved of oxygen is time wasted. So instead of having CPR all the way through from home to the emergency department, which can be 30, 40, 50 minutes, whatever, the patient was intubated early, CPR was ongoing, the patient was already in ROSC, so there was return of spontaneous circulation by the time they came to the emergency department. So that's the kind of thing that pre-hospital emergency medics do. Again, it's an extra year above the general training. So general training is 6 years in the UK. Pediatrics is an extra year if you want to. Pre-hospital is an extra year if you want to. There is also the option of doing a dual training, emergency medicine and intensive care medicine. I think it's important to clarify, by the way, that critical care medicine and intensive care medicine is the same. It's ICU medicine. In the US, they call it critical care medicine. In the UK, they call it intensive care medicine. In Bangladesh, we call it both. So ICM or CCM is a specialty in the UK, especially, which you can come through from different routes. You can come through from an anesthetic route, you can come through from an emergency medicine route, you can come through from a medicine route, a general medicine route as well, or like nephrology, acute medicine, respiratory, all of them, any of the medical specialties. So the way it works is it's again competitive. It adds to training for a long time, about 2.5 years. So there is also the option, if someone does ACCS emergency medicine, if you do MRCEM, for example, and you do ST1, 2, 3 in the UK, you can apply for just pure intensive care medicine as well. So if you want to do intensive care medicine in the UK, but don't want to do anesthetics, MR to come to do that. So you just have to do your basic emergency medicine training, like a DREAM pathway or ST123, the ACCS pathway, and then you apply competitively for an intensive care medicine number. So these three. So the ones at the top, the left and right, as you see on your screen, are the official pathways. They're recognized by RCEM. They will be on your GMC register if you do them as a separate specialty. The ones below are things that are more of interest, but are actually quite exciting as well. So sports medicine, because emergency medicine doctors deal in a lot of injuries, deal with a lot of maintaining of patient physiology, sports medicine is something that can be done. It's a very, very competitive specialty, understandably, because it's exciting. It's sports. It's something that we love, and there's not many training positions. It's hard to get training into. You have to do probably a master's and try and contact people. So there isn't specific pathways to become a sports medicine doctor. And a lot of the times they prefer other specialties like intensive care, or actually GPs are very preferred to do sports medicine, especially in sports like cricket, for example. Football prefers more emergency medicine kind of people, rugby, for example. Aerospace and aviation medicine is a very new concept, very popular in the United States, not as popular in the UK yet. It's coming, but because the UK doesn't do that much space aviation and stuff like that, there's two aspects to it. One is obviously the aerospace, which is in terms of management of people as they go to space. So the International Space Station, manned flights to space, and those kind of things, and all the physiology changes that come with it. Then there's the aviation side of medicine. So aviation medicine is actually a bit more. It's to do with anyone that's flying, and a lot of the time it will be medical evacuation. Just the day before yesterday, we had a patient from Uzbekistan repatriated to my hospital, actually 3 days ago, and that would be under the care of an aviation medicine expert, which is similar to pre-hospital emergency medicine, just a bit longer, in the sense that pre-hospital emergency medicine deals in less than a few hours, whereas aviation medicine can be many hours. Uzbekistan to the UK flight is about 6-7 hours. So things like that. Going further, wilderness medicine is medicine, for example, medicine for hikers who go up to Everest, medicine for hikers going up to Mount Kilimanjaro, medicine for trekkers in the middle of the Sahara Desert, for example. It's medicine in the raw environment where there is no one is there and you are the only one who could do medicine. So there's a lot of jungle medicine, and a lot of this wilderness medicine then taps into what we call humanitarian medicine as well. Humanitarian medicine is medicine, for example, in Gaza, in Yemen, in Syria, in Central African Republic, in Haiti, in the middle of the earthquake in Turkey and Syria. I am quite involved in a few projects with various people. There's a lot of work, and emergency medicine taps in very easily because we are the true generalists. We're more general than general medicine. We're more general than general practitioners because we deal in every kind of problem. And that is why emergency medicine doctors are very sought after in humanitarian projects, and working with the WHO or Doctors Without Borders, Medicines Worldwide, Doctors Worldwide, Medicines du Monde, and all the other Red Cross and other organizations. IOM is an option if you become an emergency physician as well, and obviously then working through those organizations in the NGO field. That is another side. It's not exactly wilderness medicine, but it comes under the same umbrella. Hyperbaric medicine is something that's actually present. I know of a couple of people who do it. It's got to do with medicine under the sea. So it's basically around with divers, submarines. Most of these people usually work with the Navy, but if you don't, you can be a civilian as well. There's two, I think. There is one specific dedicated center in the UK which trains people to do hyperbaric medicine, but there's a few others as well. Just going back to wilderness medicine, the one other very popular wilderness medicine that is done quite often is being a doctor in the Antarctic survey. So there's a lot of doctors they need to go and live in Antarctica because there's a lot of people who are there, both military and non-military, who do their, who spend time there doing research. So that is a very popular thing. So I think that covers a lot of things, but there's a lot of other things that can be done as well. Emergency physicians often are the best teachers. So going into education is an option as well, because, again, you're very generalist. And for, if you think of an MBBS patient, MBBS student, it is often an emergency medicine doctor who will probably be the best teacher, because we see patients undifferentiated. We see them in the front door. We see them, and we think of how to formulate diagnosis and things like that without any previous knowledge of what the patient's coming in with. So that's just a overall overview of emergency medicine. Obviously, that's a lot of things. If there's questions, I'm very happy to take them, and we can talk through them, in the question answer time.
Thank you very much. Thank you very much, Dr. Raiiq. So one important thing is Dr. Raiiq is the son of one of a legendary professor, Professor Dr. Ridwan sir. He's my professor in Suradi Medical College. So sir is extraordinarily talented genius. He was professor of medicine. Now he's in retired. So next slide. So I want to introduce Dr. Sanjida Anjum, one of our senior instructor. So recently she passed her MRCEM from UK, and she completed her MRCEM within just 13 months. So Dr. Sanjida.
Thank you so much for sharing the platform. Actually, when I started my MRCEM work, I had no idea that how bumpy the road is going to be for me. But yes, with the patience, hard work, and commitments, real leadership, by the mercy of Almighty and prayer of my family, I achieved the success. I'd like to thank the brilliant, truly outstanding Dr.Asif Ur Rahman for his excellent leadership throughout my MRCEM journey. Of course, to my amazing co-workers who are present here, Dr. Saurabh Sen, Dr. Jewel Rana, Dr. Tanvir Sultana, and my ex-co-workers, and all of my beloved students. So now, let me be honored to introduce the team of tomorrow's emergency medicine and critical care. You have already met with Dr. Asif Ur Rahman, the founder, Dr. Ahmed Humaida, our international instructor, me, Dr. Saurabh Sen, Dr. Jewel Rana, Dr. Tanvir Sultana. Dr. Ahmed Humaida, unfortunately, he is not with us today. He is the senior instructor of our OSCE, and he is working as the registrar in the Department of Emergency Medicine, Waterford University, UK. Dr. Saurabh Sen, the instructor, MRCEM Primary, is working as a senior medical officer in the Department of Accident and Emergency, Apollo and Imperial Hospital, Chattogram. He is one of the finest students of our institute. Dr. Tanvir Sultana, one of the brilliant students, working as instructor, MRCEM Primary, Senior Medical Officer, General, and Universal Medical College and Hospital, Dhaka. Dr. Jewel Rana, one of our brilliant student, instructor, MRCEM Primary, working as a Senior Medical Officer in the Critical Care Unit, Marks Medical College and Hospital, Dhaka. So, this is the story of success of tomorrow's emergency medicine and critical care. We, the team of the tomorrow's emergency medicine, believe that what we are going to doing together will make a difference in the hundreds of lives of doctors. Our beloved students are our inspiration. Their fabulous hard work and trust on us helped us to become the highly successful so far. So let's have a glimpse of our success story. In 2021, our first batch of MRCEM Primary appeared and passed with 100% success rate, 6 out of 6. In December 2021, 20 students appeared, out of them 17 students passed. In MRCEM Primary, June 2022, again we achieved 100% rate. It is 17 out of 17. Again, in primary, November 2022, passed 9 out of 11. We are congratulating our students again. Thank you for making us proud. So I am sharing the platform with Dr. Tanvir Sultana. Now, Dr. Tanvir Sultana, please.
Okay, thank you, Dr. Sanjida.
Most welcome.
Assalamualaikum, everyone. This is Dr. So, starting about the GG MRCEM, as we all know, it comprises of three parts as well, that are MRCEM primary, MRCEM intermediate, and MRCEM mastery. The degree as a whole can be achieved within the shortest period of time of about 13 to 15 months. On the other hand, a candidate can have maximum 6 attempts to pass for each of the parts. Now, I am going to give a brief overview about the MRCEM primary exam. Next slide, please.
Mo, would you please make your sound a little bit clear?
Ma'am, your sound is not clear.
Okay. Now clear?
Yeah, it's a little bit good now.
Hello.
Okay. Yeah. Continue.
So, to sit for MRCEM primary, you don't need to have any previous training or experience in emergency medicine. A candidate is eligible for MRCEM primary exam when he or she gets the certificate of completion of bachelor degree, which is accredited by the General Medical Council or GMC. And this is needed for the exam registration purpose. The primary exam usually takes place in 2 occasions per year. Probably one is in May or June, and another is in November. Candidates must apply for exam through online when application window gets opened. Windows opening and closing dates are given in MRCEM calendar in the RCEM web page. Now, MRCEM written exams are taken by Pearson VUE Center, which is RCEM recognized computer-based testing centers. There are Pearson VUE centers in Bangladesh and also in India as well. But as in Bangladesh, it's very limited. You have to complete your registration within the first 1 or 2 days of windows opening. Results will be published on the pre-advice page approximately about 6 to 8 weeks after the date of the examination. Now, here comes the structure of the examination. It's a 3-hour exam of 180 marks. All are multiple choice questions, and for that, single-based answers are required. The result is machine marked. You will get 1 for each right answer and 0 for each wrong answer, and there is no negative marking. So this is about the primary exam. Now I'm requesting Dr. Nehal to take over. Oh, yes.
So I will just take 1 minute. So here, Dr. Nehal is now he's with us. Dr. Nehal.
Hello, hi. Yes, I'm listening.
Yes. Dr. Nehal, regarding Dr. Nehal, he's one of the brilliant students. So he has completed his MRCAM, his MRCS. Recently, he has completed his FRCAM. So he's a brilliant doctor from Bangladesh. He's working in UK. Nehal, please, would you please introduce yourself?
Right. I don't know. Like, can people see me? I don't know. Just give me. Right, guys. I think you can see me now. Sorry, John from the. Hello, everyone. Assalamu alaikum. I'm one of the Bangladeshi student. I'm in emergency. I'm currently working in emergency medicine. Previously, while in Bangladesh, I was doing surgery. That's why, as Asif Ur Rahman mentioned, that I did MRCS earlier. But I was planning to do emergency medicine. All my training and exams that started when I moved to UK. And I finished my MRCAM and FRCAM. And currently I'm in training program and almost on the verge of finishing. So let's see, hope everything goes in the right way. I'm very happy that Asif Ur Rahman has organized this program so that new students of Bangladesh, especially the junior medical doctors and even somebody of our age or senior who would like to pursue emergency medicine from Bangladesh, so that they are aware which way to pursue it and which way to go. We are here to help. I mean, like I've been working with Asif Ur Rahman in different areas in different places. And as we went through this MRCEM, kind of the similar time frame before. And any questions regarding the emergency medicine pathways in UK, how to get involved in the training, get into the training program, or what are the prospects of emergency medicine in UK? I'm happy to answer. So whenever I know, like you have a schedule today, so whenever in the schedule, I'll try to be connected. Sorry, I'm kind of like mildly busy, but I am connected in your meeting. So whenever is you getting a time frame, feel free to ask any questions regarding the emergency medicine prospects in UK, training program in UK, FRCEM exams, and what are the other prospects in UK from the emergency medicine. Plus, if any of you is interested about like some other specialties, for example, emergency medicine and intensive care medicine, which is separate specialty, but yes, you can do it. Or if you have any other questions like pediatric emergency medicine, which is recently been accepted as a separate specialty as a second CCT, I'll explain this question if it comes to in your mind. And pre-hospital emergency medicine. So these three things is quite established pathways in UK, which is under the banner of Royal College of Emergency Medicine. Critical care medicine is under the Faculty of Intensive Care Medicine. So it comes as like a dual specialty. Pediatric emergency medicine has recently been accepted as a second specialty. And on the top, pre-hospital emergency medicine is there, but which is not a separate specialty, but which comes as like a secondary like a specialty program. So if anybody, if you have any questions regarding this, just crack on. I'm happy to answer. You can write in the chat thing. If I get into like how to do the Zoom, because we're not very used to the Zoom, I'll answer this thing. Or okay, thank you very much.
Thank you very much, Nehal. Thank you very much. Okay, so please, Dr. Who was Dr. Joel or Dr. Mo?
Okay, I would like to add here.
Yes.
For Bangladeshi students, you will have to register for the exam. You will need the fully registration number, fully registration with the BMDC after completion of your MBBS and internship completion. Now I am requesting to Dr. Joel to enlighten us about the MRCEM.
Hello, assalamu alaikum. Good evening. I am Dr. Joel Rana, one of the instructor of this institute. Today I will talk about regarding MRCEM SBA, that means part 2 exam. Requirement for this exam, you will only require just pass the MRCEM primary exam, and it's also 180 question. There is a 2 parts, 90 question for two hours, then 1 hour gap, then 90 question for 2 hours. And this is the single based question and computer based, and exam is conducted by Pearson VUE. Next slide, please. I already talked about this MRCEM intermediate SBA type question, 180 total 240 minutes. Venue, it's online. And regarding MRCEM OSCE, Dr. Asif Ur or Dr. Sanjida Anjum, so you move.
Okay, so now I want to tell you something in Bengali. Those who are Bangladeshi students, just previous 2 slides. MRCEM primary and SBA. Previous slides. So regarding MRCEM primary, first of all, you have to complete your MBBS. MBBS should be completed. Foundation training or internship must be completed, and you have to have your full GMC registration, full BMDC registration. Got my point? So কেউ কেউ আমাকে প্রশ্ন করেন যে ভাইয়া আমার MBBS করা হয়েছে, I'm in internship, আমি কি পরীক্ষা দিতে? No. To appear in the exam, you should have your BMDC registered certificate, because you have to submit this. Okay. No training is required to apply in MRCEM primary. Okay. Regarding MRCEM SBA, next slide. Next slide. Regarding MRCEM SBA, so this is 180 questions. Your time is 240 minutes, and the venue is online. So both American primary and intermediate, you can give it via online. The Pearson VUE system. This is an online platform, online system. So there are some Pearson centers in Bangladesh. There are some Pearson centers even in abroad. So you can give these exams even from your home or even from these centers. So better to give these exams from centers. Okay. So now regarding MRCEM OSCE. So this is actually a clinical, they will just judge your core clinical competencies. That means your leadership. So the way you handle the situations in an emergency department. So actually your clinical core knowledge is important here, but your leadership, how to control the situation, okay, how to take care of the patient immediately, your teaching experiences, how to break a bad news. So all of these things should be judged here in these OSCE stations. So actually here you need 24 months experiences post qualification. So ekhane here, most of the Bangladeshi students ask me, Bhaiya, we have no experiences. There is no emergency department in Bangladesh. So how will we proceed? This is a very common questions. So yes, when I appear in the MRCEM OSCE, the Royal College asked me experiences, whether I have completed my 2 years experiences. Then I gave them an official mail. In Bangladesh, there is no emergency department. But say, for example, you're working in a hospital and in the Google search, anyone can find your hospital. So there is a department or there is a room, small room in your hospital. That means emergency room. There you're working as a doctor. So just take the certificate. Yes, this is the hospital and I'm serving here as a emergency physician. 6 months, 6 months, 6 months, 6 months. That means 2 years course certificate is more than enough to apply for MRCEM OSCE. Got my point? Someone is taking training from Dhaka Medical College in diploma in anesthesia. Someone is taking training from other specialties like traumatology, casualty. So you guys can also apply. So don't make it very clumsy. Don't be puzzled that I have no core experiences in emergency. No, even you're working in a clinic, in a hospital, but at least your clinic should be present in Google search. Okay, so actually Royal College initially in our times, even recent, they don't judge whether you're working actually in yes or not, but they can judge you. Okay, they can give a mail whether you're working here or not. So if you're working in the emergency department, say for example you're working the ward, there is the emergency department. So just completing your uh, training or your duties after 6 months, ask your house officer or ask your director of that clinic or hospital to give you a certificate. Especially in that certificate, it should be written that yes, this is to certify that Dr. A, B, C, and D has worked in our hospital in the Department of Emergency Medicine, okay, for the 6 months. So by
Uh,
this, you have together, yes?
Just add a minute. I think there are a lot of people who've done EMO posts. Those posts work as well.
Yes, emergency medical office, EMO posts, yes, these will work as well. So don't be very much puzzled that, brother, I have no. You can give exam, no worries. Okay, in OSCE, there is actually 18 stations, 9 minutes in each stations. There will be 2 break stations. That means these stations are rest stations. You have to face 16 stations, and that stations, there are some history stations. There will be patient. You have to take the history of the patient. You have to reach the diagnosis. There will be procedure stations. There will be teaching stations. There will be stations like breaking bad news. That means this patient recently died and you have tried your best level, but unfortunately you failed to save the patient. The patient's relative becomes so much angry, he's just shouting. And there will be some role player, there are some role players, they will really act like just like that. Yes, you're facing a real scenario. That means he may shout, why my patient died, what do you do? So you have to handle all of these situations, and the examiner will just make sure that yes, if this guy is capable of handling such situation. Okay, they will try to irritate you. They will try to even they can use some not too slang, but they can use you are a worst doctor, the department is worst. So these are the scenarios. They will judge your core competencies, your leadership. Say, for example, there are some trauma stations, ALS stations, TLS stations, even pediatric emergencies. So they will judge a patient arrived, how you deal this patient, how you treat this patient. So all of these things. Okay. Okay. So regarding MRCEM OSCE, first thing you have to complete your internship. That means 1 year or FY1 or foundation training or foundation year. After that, you have to complete 2 years training. Training means 2 years experiences. What Dr. Nehal told that yes, EMO post is more than enough to apply. You're working in a clinic as a doctor. So just take the certificate. Yes, I'm working there as an emergency physician. Okay. Okay, next slide. Okay, Dr. Sanjida, please, would you please continue?
Oh, sure. So regarding the syllabus, this is the blueprint from the RCEM. So for primary, you have to face the anatomy, physiology, pharmacology, microbiology, as well as pathology and EBM, that is the evidence-based medicine. So from the anatomy, we'll cover upper limb, lower limb, thorax, abdomen, head, neck, almost all the stems which we have faced in our first prof. Okay, so it will carry about 60 marks. In physiology, it will also carry the 60 marks. Pharmacology, it will carry the 24 marks. From the microbiology, you have to face 17 marks, pathology 9 marks, and EBM 7 marks. So in total, it's 180. Okay, so this is the primary overview.
Let me tell something.
Yes, please.
Regarding primary syllabus. Just previous slide.
This one.
So here you see in the anatomy part, there are upper limb, lower limb, thorax, abdomen, head and neck, and central nervous system, even cranial nerve lesions. One thing you should keep it in your mind, all the scenarios should be in emergency basis. That means, say for example, in the upper limb, they will not ask you, what is the nerve? What is the, no. Maximum question like this, you have sustained a cut injury, a patient came to you with a sustained cut injury in the left upper hand, or which muscle may be involved in the, so all of the questions will be scenario based. Okay. So other thing is regarding physiology, basic cellular physiology, respiratory physiology. This is very much important. Each and every year, 5 to 7 questions come from respiratory physiology, cardiovascular physiology, 4 to 5 questions, gastrointestinal physiology, 2 to 3 questions, renal physiology. You will get 5 to 6 questions regarding acid-base disorders. Okay, and endocrine physiology, 2 to 3 questions. So these are the pharmacology, gastrointestinal pharmacology, cardiovascular pharmacology, very, very important, respiratory pharmacology, nervous system, endocrine system, fluid and electrolytes, very, very important, musculoskeletal system, immunological, and anesthesia. So from anesthesia, you will get 5 to 6 questions. So these are the pharmacology syllabus. Microbiology, pathogen-based microbiology, pathology, inflammation is very much important, immune response is important, infection, and the wound healings. And evidence-based medicine, the biostatistics, study methodology, and principle of critical approaches. So these are the syllabuses, and there are vast subspecialties we'll discuss later on. Okay, please continue.
So regarding MRCEM SBA, this is the syllabus. Actually, it's a very vast syllabus in SBA. The SBA actually the question comes from SLO. That is the SLO means the specialty training outcome. Okay, so and here is the some categories from SLO 1 to 10. But in SBA there is SLO 1, SLO 3, SLO 4, 5, 6, and 7. Rest are the SLOs are for the OSCE and FRCEM. So the SLO 1 covers the most of the 180 marks, that is 55. In this SLO 1, that is the complex stable patient, you will get question from the allergy, cardiology. The most of the question comes from cardiology, then dermatology, ENT, also elderly care, 1 to 2 questions, endocrinology, environmental emergency. This is one of the very important, and you will get about 2 to 3 questions from here. Gastroenterology and hepatology, hematology, infectious disease, maxillofacial, and dental. Mental health, musculoskeletal. Here is the non-traumatic. Traumatic will go into the resuscitation. Okay, then nephrology, neurology, obs and gynae, oncological emergencies, ophthalmology. You see, almost all of the subjects of medical is counted in a complex stable patient, that is SL1. Pharmacology and poisoning, respiratory, sexual health, and the surgical emergencies, urology, vascular emergencies. So it will comprises about 55 marks. Then resuscitation. It's a very vital part of the SBA syllabus. It will contain the resuscitation, palliative end care, then trauma, including other clinical presentations. Okay, it will comprises of 40 marks. Injured patient, pain and sedation, major trauma, including other clinical presentation, that will carry 30 marks. Pediatric emergency medicine, SLO5. You have to know all the pediatric emergencies that you will face in the emergency department, including the neonatal emergencies. It will carry 25 marks. And it's a very important subject here, safeguarding and psychological emergency in children. You will get about 2 to 3 questions from only this safeguarding. SLO6, that is the procedural skills, and the procedural skills also acute care common stems will included in it, and that will comprise of advanced airway management, chest drain, external pacing, fracture and dislocation manipulation, lumbar puncture, pain and sedation, focus, and vascular access in the emergency, that is IO, interosseous line, femoral vein, and wound management. That means the most commonly you will deal with this part in the emergency department. It will carry 20 marks. Complex challenging situation, SLO7 again, that is the legislation and legal framework, organ and tissue donation, information of governance, and safeguarding, evidence and guidelines. That will comprise of 10 marks. Total 180 marks. Now regarding MRCEM OSCE, I'd like to invite Dr. Asif Ur Rahman again.
So, okay. So what I've told earlier, so there are some SLOs, that means specialty learning outcomes. So I think you should not go these SLO1, SLO2, SLO3, SLO4. So you have to have a core idea regarding history, how to take a history from a patient. Say, for example, a patient came with you with abdominal or tummy discomfort. So what's the diagnosis? You have to reach the diagnosis, asking the core gist and not questions to the patient. So you have to reach the diagnosis. You have to tell him the management plan and the investigations. So these are the 4 to 5 stations will come from just history taking. Okay. And another thing is answer questions. So races. So answer question means it may be some scenarios, that means you have to reach the diagnosis. The patient may ask you what I have to do now, what should be the next approaches. And in the races, there will be at least two races stations, and you should face a trauma station. That means a patient with chest trauma, a patient with blunt abdominal trauma, even a patient with stab injury, gunshot injury. So there are lots of scenarios. You have to receive this patient, resuscitate the patients if needed to perform, just show how you perform a chest drain. Okay, needle paracentesis, cardiocentesis. Okay, how to perform the focus. That means to see the collections in abdomen. So these are the trauma stations. Even vascular injuries, it may come. And another station is ACLS. That means a patient with cardiac arrest came to you, how you should approach, how you should manage. So actually in these scenarios, they will just look for your leadership, your core knowledge, and how you manage your team and how you manage the situations. Okay. So other stations like injured patients, what I have told you, trauma stations, and pediatric emergency medicine, a patient with, say, for example, acute exacerbation of bronchial asthma, bronchiolitis, and other diagnoses. Patient came to you like apnea, stridor, alti. So there are lots of stations there, and procedural skills. So you have to show your core procedural skills through the mannequin. Say, for example, local nerve blocks, how to perform ultrasonography. There may be a student in front of you. You may be a teacher. So you have to teach your patient. So here's the mannequin. You should follow me. Come here. Okay. So this is the way how you perform this procedure. So your teaching skill will be observed and your teaching skill will be marked by the examiner. Okay, fine. And complex challenging situations, what I've told you earlier. Say, for example, errors. One of your nursing staffs, okay, gave high dose of insulin, patient became hypoglycemic. One of your nursing staff gave KT, patient became arrest. One of your nursing staffs gave high dose of midazolam or high dose of propofol. So actually, you have to deal with these errors, how you manage this patient, how you approaches, how you show empathy, sympathy, how you accept the duty of candor. That means you should apology. Yes, we have done a mistake, and you have to manage the patient legal guardian. So these are your skills. These are your core competent. So this is the way how you manage that situation. Sometimes patient party may be very angry. So dealing with a serious incidents. So these are the complex challenges. Okay, fine. And supervise and teaches. So there are other stations like psychiatry. There may be other stations like depressions. So lots of stations. So you have to perform 16 stations. There will be 2 resting stations there, and each and every stations should carry 9 minutes time. Okay. Okay. Next. Okay.
Dr. Short
Well,
option.
oh, just before show up,
Yes.
so I want to please previous slide. Previous slide. So MRCEM OSCE. So OSCE, you have to give this OSCE outside Bangladesh. Okay. There are some seats in India's like Hyderabad, Chennai, Delhi. There you can give your exam in Malaysia. You can give your exam in Oman. You can give your exam in UK also. So the OSCE part, it should be given outside Bangladesh. You can't give it via Pearson VUE system. Okay. Okay, next.
Dr. Short option.
Thank you,
I-
Dr. Sanjida.
Yes. Please.
So, how to ace in 6 months? The key of success to pass is the perseverance of lecture, and only lecture. Because in our lecture, we tried to cover the whole syllabus, which is designed very attractively and easily palatable for you. So of you have to do just follow the lecture, do your own notes, and practice it again and again. Always try to remember time is muscle. So do not try to waste your valuable time by following and jumping in different resources. Follow and listen all of the instruction that will be given in lectures and participate actively during lecture time. Do your own notes, read and practice it again and again. So again, don't waste your time. Focus to your dream and you will be succeed. So now I am requesting Dr. Asif sir for continue the session furthermore.
Okay. One thing is important here. I'm telling all of my students, coaching is not mandatory. Coaching is not mandatory. Again, I'm telling, coaching is not mandatory. So we just gave guidance, and yes, we are very expert regarding because we analyze coaching questions each and every year, and we have an idea from which topics the question may come. So one thing you should keep in your mind, you should take preparation from retrograde. What is retrograde preparations? You have to solve all the past year questions. Someone asked me, doctor, if I read success, is it enough? I don't know. But day by day, question is becoming harder and harder and harder. Why? Because previously RCEM was a little mercy, but day by day they became very much rigid and questions day by day, it became harder and harder. So one thing you should keep it in your mind, if you solve all the past year questions, if you go through each and every topics, say for example, axillary nerve, go through each and every single line of axillary nerve. So the root value of the axillary nerve in this year, it comes the root value of axillary nerve. Next year, it may come what are the clinical features, what are the clinical features of axillary nerve injury, a patient with anterior posterior shoulder dislocation, he has loss of sensation in regimental badge area, what the nerves may be involved. So topic followed by retrograde preparations. What I'm telling you, don't go through all the topics, because most of the say for example success exam preps, so they collect questions from lots of sources. All of these topics are not so much important. So what we do here, we just help you to make a core preparation. Yes, we will tell this topic is not important, forget it. This topic is important, go through it. That's the way we help our students. Got my point? And past year question is very much important. Solve all the past year questions. If you solve all the past year questions, say for example, you have solved 12 to 13 past year questions, 13 into 180, that means lots of topics, lots of topics. So each and every day, go through the topics, try to make a good preparation from retrograde, not from anterograde. So median of no. See from median of what the questions came each and every year, what the important topics the Royal College likes. So go through it and make your core preparations. Okay. Next slide, please.
If you don't mind, before going to the next slide, I have a very special guest with me.
Yeah.
She's my mother. She wants to show some gratitude on you. So I am sharing the platform with her.
Okay, sure.
She's coming from my ID actually.
Hello.
Yeah.
Hello, Assalamualaikum. Actually, দেওয়ার মালিক তো আল্লাহ, অর্চির চেষ্টা আর আল্লাহ দিয়েছেন আপনাদের সবার সহযোগিতা আমার মেয়ের এই অ্যাচিভমেন্টে আমরা সবাই খুব খুশি। আপনাদের সহযোগিতার জন্য আপনাদের সবাইকে অনেক অনেক ধন্যবাদ। আর অর্চি নিশ্চয়ই অনেক দূর এগোবে, আপনারা ওকে দোয়া করবেন ওর জন্য।
জি ইনশাআল্লাহ।
জি, থ্যাংক ইউ ভেরি মাচ।
থ্যাংক ইউ।
Thank you, ma'am.
Thank you. So it's proud because you have completed within 13 months. Okay. So next slide.
Sure. Yes, the next slide. Hello.
So we have launched a new batch of signature batch. We're just going to start from this 25th May. So what materials and what the facilities you will get? Okay. So we will there are weekly online classes via Zoom, and we'll take more than 40 live classes. And we have saved lectures. You will get access more than 80 GB of cloud recorded lectures. We'll discuss the high-level topics and up-to-date elaborate with detailed lectures, and we will follow definitely the RCEM curriculum. And we will solve all the past year questions, and we will discuss. And we'll take the revision lectures. And here we have some Telegram groups. These are the dedicated Telegram groups. We are here for 24 hours. And we'll take 10 mock tests before your exam. And we'll give you some rapid revision notes. Sorry. Okay. So we'll provide you 2 books. One is MRCEM Primary Past Paper Solved Questions, and another one is a brief overview. So this book is not all important, this brief overview. Say, for example, topic followed by topic discussion, and you have to follow this book perfectly. That means all past year questions solved. Okay. Regarding SBA, next slide, please. So regarding SBA, so here also we will provide 2 books regarding RCEM learning. So here we have 600 to 700 questions there, and another one is questions bank. So these two books will be provided by our institute. These books are totally made and prepared by our mentors. Okay, here we will give you 2 lectures per week, and here we will take also 40 live lectures, and you will get access over 60 GB cloud recorded lectures. Here also high topic discussions, elaborate and detailed lectures, and we will follow the RCEM syllabus. Okay, and we'll provide you all the study materials. That means these 2 books and our cloud access, that means our drive access, you will get it. And if you miss any class, and yes, obviously you will get the class in our drive. Okay, next. In our OSCE batches, same here. There are 15 GB cloud recorded lectures. We'll take 40 live classes, and classes will be taken via Zoom, and each and every week we will start the practical class. That means we have mannequins. We will show how to intubate a patient, how to give CPR, how to defibrillate a patient. So hand-to-hand workshop followed by Zoom classes. Okay, and we'll take mock tests with real exam scenarios. So these are our materials. Next. So these are the books from our institute, and in the market, these you will not find these books because these books are prepared by our admin panel and our editor panels. These 2 books for the primary, these 2 books for the SBA, and this book is for OSCE. Okay, next. So actually, these are the chapters: physiology, anatomy, pharmacology, microbiology, pathology. Next. And we'll cover whole RCEM syllabus. Here you see the reference and resources from the NICE, SIGN, RCEM Learning, GMC, Tinitalis, ATLS, Oxford. So all the reference books, we have collected informations from all of these books. So I think if you go through this book, it's more than enough. But I think this book is also not, all the topics from this book is also not important, so much important, just important topics. We will tell you this topic is important, go through it, and you have to go through these topics from this book. Okay, next. Okay, so now I'm requesting Dr. Mo to continue, please.
Thank you. Yeah. So a candidate can open account and complete the registration from RCEM webpage. A video recording regarding RCEM account opening and another video regarding the exam overview are given in our Facebook page. These 2 videos are also provided in our Telegram group. Now about the credit card. Your credit card should be up to date to make the payment, and option of your currency must be there in the credit card. Otherwise, you can't make payment. And you can also make payment by any international credit card as well, which is more convenient. Now about the Pearson Booking Center. After completion the registration, you will receive an email from the Pearson Booking Center regarding the seat booking. From there, you can seat your group. You can book your seats as soon as possible. That's all from me. And now Dr. Nehal will take over.
So one thing I want to add here before Joel, please, just 2 to 3 words regarding account opening. We'll give you link in our general group, as well as in our closed group. You will get the links. By seeing the video, you will get a clean-cut conception how you open an RCEM account. Then how Pearson VUE system will, we have also the videos, we'll upload it in our closed group, no worries. And regarding exam booking, you have to have a credit card with dual currency, make all the arrangement before, when, say for example, when the opening, that means today at 10 p.m. your booking starts, try to complete it within 1 to 2 hours, because there's a huge rush. If you make delay, okay, 2 to 3 days, 4 days, you will may not get the seat, because day by day the number of candidates increasing. So prepare all of these things earlier, and just in the opening day, gate opening day, complete your registration. After registration, they will give you options. That means there are lots of centers in Dhaka city. Now, day by day, they are decreasing the center, whatever. Still now there are more than 20 centers in Dhaka. Okay. So you have to choose your center. Say, for example, your home is in Banani, choose a center uh, beside Bonani. If you are in from Chittagong, try to choose the center from Chittagong. So don't make delay. If you make delay, you may fail to give exams. So you have to book abroad. That means from India or other states. Okay. Okay. Next, Dr. Jewel.
This is Dr. Joel again. Regarding examination date and venue, all are you can found in RCEM website. In RCEM website, you'll get MRCEM primary in every year 2 times. There will be May and November, and regarding MRCEM SBA, every year in Bangladesh, there will be Bangladesh and international. There will be 2 times, April and October or February, and there will be diet 1 and diet 2. Diet 1, you can find opening date, closing date, and examination result also in RCEM website. Regarding examination fee, MRCEM primary, it's about £330, and MRCEM SBA £335, and regarding MRCEM OSCE, it's different in different places like London 450, India 650, and Malaysia 750. Next, please.
Okay, I want to tell something. Please go to the previous slide. Previous slide. So here, try to give exam from your motherland, because just I want to share one of my experience. In 2017, I gave the American primary. I have to move to the Chennai, and because there are huge changes in food habits, I suffered a lot, because this totally new place, food habits as well as the accommodation, all of these things plays a vital role before exam in psychology. So I think that always try to make you center in your native land. That means in your homeland or in your hometown. Okay. So if you miss it, then you have to go to other states, even you have to give exam from abroad. So this will create hazards, because you have to collect your tickets, visas, okay, hotel seat booking, go to the that place 6 to 7 days earlier in the exam. It will take some time to keep pace with that atmosphere. So there are lots of hazards and problems. Okay, so always try to give primary and SB from your hometown. Okay. Okay, next. Okay. So regarding road to GMC, do I need PLAB after MRCEM? So this is a common question which we each and every day, most of the students ask me, doctor. So yes, PLAB is a very sophisticated route. Even membership is another route. So by both route, you will get the GMC registration. One thing is important, that before PLAB, you have to complete your OET, and after MRCEM, you have to complete your OET. So I don't want to make huge differences between these two routes. Both are very, very prestigious route. So one thing is important here, after completing PLAB. So my suggestion is try to complete, at least if you want to build your career in MRCEM, that means in emergency medicine, after passing PLAB 1 or part 1, try to complete MRCEM primary, because if you have MRCEM primary and SBA, even after passing PLAB, okay, the employer will receive that message that yes, this student or this doctor wants to build his career in emergency. So it will be very easy for you to get a job in emergency department. So if you completed both MRCEM part 1 or even part 2. Okay. And membership, through the membership, after completing the membership, if you have some training in your native land, you may get job in ST3, ST2 level, okay, based on your competencies, based on your experience. And from after PLAB, it's ST1 or even ST2. So one is register post, another thing is SHO or junior register post. So there's a little bit gap. So both are very sophisticated pathways. You can choose PLAB, even you can choose membership. It doesn't mean MRCAM. You may choose MRCP, MRCS. So both routes are approved by GMC. One is before PLAB, you have to complete the OET PLAB. And one thing is important here, from Bangladesh, if you go for PLAB 2, it takes a lot of money because going here in UK, giving PLAB 2, most of the students have to pay approximately 3 lakhs at least, isn't it? But MRCAM, you can give it from India, you can give it from Malaysia, you can give it even from Dubai. So I think that is a economical matter, economy matters here. So both we are good enough. So you can choose any route. But my preference is those who are already in PLAB, after passing PLAB 1, try to complete at least MRCEM 1, 2, or even after completing PLAB, try to complete MRCEM part 1 or even part 2. So you will get a good job there. Okay, next slide. So Dr. Nehal, do you want to add something here, or Dr. Raiiq?
একটু মানে এই কথাটা আগের স্লাইডে যে কথাগুলো আপনি বললেন এটা একটু যদি বাংলায় সংক্ষেপে বলতেন, প্লাব আর এমআরকেম এর ব্যাপারটা।
আচ্ছা, বাংলায় যদি বলি, ইন বেঙ্গলি, প্ল্যাব হচ্ছে, this one is also a route of GMC registration. PLAB 1 and PLAB 2 আপনাকে পাস করতে হবে, and MRCEM, after completing MRCEM, you will also get GMC registration, isn't it? So before PLAB আপনাকে OET পাস করতে হবে, then আপনি PLAB 1 এবং PLAB 2 দিবেন। আর MRCEM এর পরে আপনাকে OET দিতে হবে। After OET completing, you will get your GMC registration. এখানে মেইন ডিফারেন্সটা হবে, PLAB পাস করার পরে আপনাকে SHO বা ST1 অফার করা হবে। বাট আপনি যদি MRCEM কমপ্লিট করেন উইথ OET, এবং আপনার যদি বাংলাদেশে কোনো ট্রেনিং থেকে থাকে, সে ফর এক্সাম্পল ইউ হ্যাভ ডিপ্লোমা ইন অ্যানাস্থেশিয়া, or you have 3 to 4 years core training in emergency or in acute medicine or even in internal medicine, আপনি ST3 বা ST2 এর জন্য বার্গেইন করতে পারবেন। আপনি আমার কথা বুঝতে পারছেন? আপনার পোস্ট হবে রেজিস্টার। সো এখানে একটা বেসিক স্যালারি ডিফারেন্স হবে আপনার, ঠিক আছে?
বাইরের জব অপরচুনিটির জন্য জাস্ট, তাই তো?
হ্যাঁ, জব অপরচুনিটির জন্য আপনার এখানে একটা স্যালারি একটা রেঞ্জের একটা ভ্যারিয়েশন আসবে। হ্যাঁ, এই কারণে আমার সাজেশন হচ্ছে দোজ হু হ্যাভ কমপ্লিটেড প্ল্যাব অর ইভেন আফটার পাসিং প্ল্যাব, আপনি যদি ইমার্জেন্সি মেডিসিন, ইফ ইউ ওয়ান্ট টু বিল্ড ইউর ক্যারিয়ার ইমার্জেন্সি মেডিসিন, ট্রাই টু কমপ্লিট পার্ট অ্যাটলিস্ট প্রাইমারি অর SBA। সো এটা তখন আপনাকে প্ল্যাবের সাথে আপনার যদি মেম্বারশিপ পাথওয়ে ওপেন থাকে, এটা আপনাকে বুস্ট আপ করবে, এবং যিনি আপনাকে এমপ্লয় করবেন, দ্যাট মিনস হসপিটাল তখন বুঝবে যে ইয়েস, দিস গাই হ্যাজ MRCEM পার্ট 1 পার্ট 2, ওকে, তখন ওরা তাকে আপনাকে ইমার্জেন্সির জন্য অফার করতে পারে, ঠিক আছে? আর প্ল্যাবের যে প্রবলেমটা, আমি আপনাকে একটা জিনিস বলছি, প্ল্যাব হচ্ছে মানি কনজিউমিং। আপনার প্ল্যাব 2 দেওয়ার সময় আপনি যখন রয়্যাল ইউকে তে যাচ্ছেন, খোদা না করে যদি একবার প্ল্যাব 2 খারাপ হয়, আমার বেশ কিছু স্টুডেন্ট আছে যাদের প্ল্যাব 2 খারাপ হয়েছে, তারা মেন্টালি ডিপ্রেসড, ভাই অনেকগুলো টাকা, 4 লাখ 5 লাখ টাকা নষ্ট হয়ে গেছে বা হয়ে গেছে। সো MRCEM আবার এই প্রবলেমটা নাই। MRCEM আপনি পার্ট 1 পার্ট 2 বাংলাদেশে দিলেন, OSCE আপনি ইন্ডিয়াতে গিয়ে দিয়েছেন, সেক্ষেত্রে আপনার 1 লাখ টাকার মধ্যে হয়ে যাচ্ছে। সো এখানে একটা মানির একটা ব্যাপার স্যাপার আছে, ফিনান্সিয়াল একটা বিষয় আছে, বাট বোথ রুটস আর ভেরি ইফেক্টিভ এন্ড ভেরি প্রেস্টিজিয়াস রুট। ওকে, নেক্সট স্লাইড। Dr. Raiiq, Dr. Nehal, would you want to add something regarding PLAB and MRCEM?
Let me add a couple of things actually. I think I get this question all the time. Do I do PLAB? Do I do MRCEM? And it depends very much on who you are and what you want to do. If you're definitely sure that emergency medicine, or at best intensive care medicine, is what you want to do, then definitely go for the MRCEM route. I think it's not short, but it's still doable. within a reasonable amount of time. If you're still unconfused and you don't know what you want to do with life and you just want to explore and things like that, then I think PLAB is better because it sets you up as a junior doctor. You can decide to work in medicine, surgery, dermatology, I don't know, medicine, radiology, whatever you want. So I think from that point of view, PLAB is better. So traditionally, I would have always said actually PLAB ahead because obviously it's, please don't hit me, but it's slightly easier exam compared to MRCM. But it's getting harder to get space to do it, whereas MRCM often will always have space. And these days with newer, I mean, the Malaysia center is actually quite new for OSCEs as well. So, but it seems like they've stopped doing OSCEs this year in Dubai and Oman. So I think they've like just basically shifted that to Malaysia. So overall, I think there is, it doesn't really matter what you want, as long as if you want to do emergency medicine, then MRCEM is really the route to go through. But if, you know, because for a lot of people coming from Bangladesh or from other parts of the third world, you don't actually know what emergency medicine is. So you don't, if you don't want to commit to a specialty that you don't know about, because, you know, it's easy. I've seen people who thought they were very interested, who thought they knew what they wanted, and then they come into the emergency department and they see someone with their legs open. You know, road traffic accident, one leg is up, one leg is barely salvageable, for example. And that really terrifies people because they thought they were only going to do medical emergencies. They were going to deal with the MI, the pneumonia, and everything. On the other hand, we see a lot of people who are very surgically minded in their head, and then they will come to emergency medicine and, you know, suddenly have to deal with a patient with fast atrial fibrillation, with rapid ventricular rate. And then they're like, oh, how do I do this? I don't know how to do that. So there is that as well. I think there is importance in understanding, I think in either case, instead of just jumping to it based on what someone else has said, I think it's very important to decide, you know, with insight into what you're doing. What is it? Why do you want to give MRChem? You know, I get an email or a message on Facebook every single day, at least 3 to 4, about people wanting to do MRChem. Some of them have no idea what it is.
Yes,
some of them have never actually been on the RCEM website.
Yes,
you know, they've just heard it's a way that they want to do it. You know, and then as you start unpacking it becomes a bit difficult. So whether it's PLAB, whether it's MRChem, it doesn't really matter. If both are the routes to do one thing, which is, you know, get GMC registration, isn't even necessarily to stay in the UK, because one can work with a GMC registration for 12 months and decide to move elsewhere. Because the good thing about GMC registration is it makes you qualified for the world almost, other than a few countries. Most countries will accept you with a GMC registration, even at the junior level. So, you know, it doesn't really matter. I think MRChem is the better option if someone wants to do emergency medicine. It's not an easy ride, but it's still, you know, it's got a smoother way of learning to it. You know, it's got specific syllabus. It's not, you know, it's not terribly difficult either, and it's possible and it's doable.
Yes, doable. Okay, thank you very much, Dr. Raiiq. Next slide. Do you have any questions? If you have any questions, please drop it in our chat box. Okay, we'll discuss it later. Next slide. Okay. OET IELTS. So in IELTS, yes, you can give OET, even you can give IELTS. So for IELTS, at least 7 score in each and every reading, writing, listening. And so 7 score is required at least, and in OET, at least B is required. So you can give both of these, but before MRChem, OET is not required. After passing MRChem, to get the GMC registration, OET is required. And regarding PLAB, these required earlier for PLAB 1 and PLAB 2. Okay, next.
Before going to question and answer, I'd like to invite one of our students just appeared in the primary exam, Dr. Saidul. Are you there?
Yeah.
Please, can you share your experience in 2 to 3 lines with us?
If I want to share my experience, it's not within 2 to 3 lines, it's quite more than 2 to 3 lines, I think. First of all,
I appreciate.
Okay. Introduce myself. I am Dr. Saidul. So, if I want to share my experience regarding tomorrow's emergency medicine, first of all, recently I have get my primary. Hopefully, I will pass. Okay, but before I share my experience, I have to tell you one thing that I'm little bit senior most student among the running students. So because of some of my personal issues, I have to stop my post-graduation studies now, after almost 10 to 15, 12 years of the break of my studies. One day I find this tumor image medicine website. Then I talked to Dr.Asif and share my position that and told him I want to build my career in emergency medicine. What should I do if I want to do things in now? Then Dr. Asif assured me that medicine is nowadays is the most valuable and as well as most prestigious subject in the world. So after that, I joined and found the really amazing teaching staff, including Dr. Asif, and there's so much caring about every single topic. When I get stuck, there's so much caring about every single topic. When I get stuck, actually, overall, I think their syllabus is a complete package for MRCEM of every aspect. So I will continue. If I fail or pass, anything is happened, I already told Dr. Asif, I'll continue with his institute and with him, because he is actually not a mentor. He always gives me the inspiration that you can do. So that inspiration also gave me so much confidence. So after all these years, I started learning again and find learning so much enjoyable. So if you anyone here wants to build a career in emergency medicine, so they should work with this institute. And I think if they work with this institute, he or she will not be disappointed. I think that's all I can say.
Thank you, Dr. Saidul. Now I'd like to invite Dr. Tariq Hassan from Pakistan. He is our international batch student. Dr. Tariq Hassan.
Assalamu alaikum to everyone.
Walaikum assalam. Can you please share your experience?
My name is Dr. Hassan. I am working as a currently newly started as assistant professor in general practice family medicine department. Well, it's not easy to explain in one or two words about the tomorrow emergency medicine and critical care, but one day I have had a bad experience in A&E when I was there to see my own patient, and I just see a young gentleman. He was brought to the ER, and while entering into the ER, he was collapsed at that time. So I just rushed because I straight away shock him, and he sit down in the bed. So we have a very bad discussion with the specialist, internal medicine on call, and that day I decided to go for MRCEM. So I searched out, and I eventually found the tomorrow emergency medicine. So I directly contacted Dr. Asif, and I text him, and followed by in 1 or 2 minutes, and I get a reply from him. I just call him directly on his WhatsApp number. Actually, mentors are available around the globe, but you can text them, or you can get a reply from that up to 2 or 3 hours, or they can give a reply in a very short word. But actually, I call him and he pick up the call, and I discuss the things with him that I want to go for MRCEM. Actually, the thing was that I was basically 10 years from my basic medical sciences, because I was practicing as in a family medicine department, and also as a specialist for them. But actually, when I found this Dr. Asif course, so initially I was thinking that doing the basic sciences up to 10 years is a quite difficult thing to pick out the anatomy, physiology, all these things, and start from the day one of the medical school. So he just explained the things, and he assured me that you just go with us. When I go for that, Actually, the anatomy, which was very difficult for me, even in my medical school, and I had that at that time as well. But he explained things very well. It was a very good experience to learn. Like I was busy in two jobs, one in a government hospital with the AP family medicine with them, and the rest with another job in the A&E of another hospital, which is a private secondary hospital, to work with them as a emergency medicine medical officer at that time. After that, currently I was being promoted as there as a senior medical officer in emergency department. And I start learning things and taking his sessions, lectures. It makes me able to, in my interest, develop more in the A&E. Actually, so I didn't read any book for my primary exam. I just listened his lecture twice, thrice, three times. And I practice only the book provided by him. No other books I have studied for this primary exam. Actually, the primary exam was very conceptual, and is compared to the previous Q banks. If you compare, they are doing it to make it harder day by day. This time the questions were very tricky, but Dr. Asif, the way he explains things, it makes you able to understand and you can answer any type of question. Now, I would recommend all of the students who are thinking up to select MRCEM as their postgraduate exam or their future. So I would strongly recommend to go for this course, because considering myself, when I was 10 years from the basic sciences, I start and learn a lot from him. And actually, truly speaking, I haven't remembered anything of the basic sciences on the first day when I started for MRCEM primary. And this course make me able to learn things. And I always mention to Dr. Asif that this is the first time in my career that I learn anatomy. Even today, I reduce an anterior dislocation of the shoulder joint, which was very amazing for me. I just pick out the Google it on YouTube how to do a Cocker method, and I did it, and the patient was happy. So I would highly recommend to go for this, whether I should pass or not, but I will continue with the tomorrow emergency medicine for the next attempt, or if pass, will continue for the SBA as well. So thank you very much, the entire tomorrow emergency medicine critical care team, their all the mentors, the admin, and I am very much thankful to Dr. Asif. And one thing more, like previously in all batches, the students were from Bangladesh. And this time we were two from the international candidates. One was Dr. Asif, he might be here, and one was me at that time. And Dr. Asif was so cooperative, though he scolded us, but it's not that he is bad, but actually he want to pursue, and he want that we can learn and continue to pursue everything and to learn and apply this all things on a patient in exam. So he converted all the lecture in English just for two candidates who were internationally for the last batch. So I would recommend go for it. No worries for to pass the exam. It's quite easy if you can just listen to him, listen and follow the lectures, and only use question bank just in order to make how to utilize the previous knowledge. Thank you very much.
Thank you, Dr. Hassan. Now I'd like to invite Dr. Nasir Had. Are you there? Another international student from our primary batch.
Yes, hi, hello.
Hello. Can you please share your experience?
Yes, it is a pleasure and honor for me to speak on this occasion. Really, Dr. Asif is an amazing mentor, and his teaching style is very nice. And as my colleague Dr. Hassan has said, that the way he teaches and tells you the thing to memorize it is fantastic. And my advice will be also to the primary candidate that just follow the, as Dr. Asif says, lectures, lectures, and lectures. because when you're going for such an exam, you need to have a clear idea and conception about the question which comes in it. So the lectures are very important, and everything is there. Just concentrate and focus on that, and don't miss the lectures. Repeatedly review it and make your own notes of it. And I'm very much confident that you will succeed in the exam. No exam is difficult, but with tomorrow's the critical care emergencies team and leaded by Dr. Asif is giving the main thing so that you can easily clear the exam. You don't need to go for another step. Just the lectures, make your own note, and you will be succeeding in your exam. As we have also gone through it, and I remember most of the questions were from the lectures, and once you recall it, that you know it, it will be just echoing in your ear that I have read this in the lecture, or I have written a note of it, and you just answer it. So it's an amazing journey with Dr. Asif and his team. Again, I would say that I will continue my studies with this in SBA and OSCE as well, because I'm much confident in going to exam with the support of Sir Dr. Asif and his team. It gives you a lot of confidence when you're going to exam and you think that you know the things. Yes, the exam was tricky this time, but with the preparations and the lectures of Dr. Asif, nothing is impossible. You can achieve it very easily. Just follow the lectures, be paced with the lectures daily to day, daily. Just go with it. And the other colleague, Dr. Sanjida and Dr. Um, the microbiologist, Dr. Jovel, he's also fantastic in his explanation, the way he gives the things, and all the teachers and the mentors of this. It's an amazing, and I would recommend it for all of you to just go and pace with the lectures, and inshallah, hopefully you will be succeeded. And thank you once again for giving me an opportunity to speak on this occasion. Thanks a lot.
Thank you so much, Dr. Nasir. Now I'd like to invite Dr.
pleasure.
Maruf Abdullah. Are you there?
Hello.
Hello.
Assalamu alaikum.
Walaikum assalam.
Hello.
Dear. Can
You are
you
listening
please
me?
share your experience?
Assalamu alaikum to everybody. Actually, I am Dr. Maruf. I am working in Ministry of Health, Saudi Arabia as an orthopedic resident. Actually, it is my great pleasure to give my experience to this all audience here. Actually, when first I am talking with Dr. Asif and I am asking regarding me, my conditions, I have a very long study gap. Can I join to your institution to give this MRCEM exam? He told me and assured me and given me the belief you can pass if you follow our instructions, what we are giving the lecture. If you are working with us, inshallah, you will succeed. My experience actually, in the last May, I given the exam. Already explained our previous 2-3 student regarding exam, but I will pass or not, it is my potentiality and depends on Allah. But as a mentor of Dr. Asif and his institutions, all instructor given me 100%. It is my personal experience and opinion. Actually, this type of confidence they given to me, that makes me and given me the really confidence, and that's called boost up me. Actually, after long time, long study gap, I have little bit confused regarding me, but at least they given me the confidence. It is nothing is impossible. This is my recommendation to everybody here or who is listening my words. I can give the recommendation. This institution can make you and guide you how to pass the MRCEM. At last, I given the thanks to Dr. Asif for your guidance and all instructors who is here. Again, thanks to all. Thank you very much.
Thank you. So now I would like to invite one of our SBA students, Dr. Shorna. Are you there? Dr. Shorna. She might be busy.
I would like to add one thing. All those
Yes,
candidates who are listening to this session currently, at least they should go to the Facebook page and they should listen the demo lecture. They're available on that, and they should just recall the medical school in this session. They will really amazed and they will immediately decide to go for this course. So I would recommend go for the Facebook page, find out the demo video for the primary or those who are for SBA. You will definitely go for this, because what I think when I was a medical school, these all things were might be taught during this our classrooms, but I don't remember even a single things, or I might not be interested at that time. Can't comment on that. But actually, I would recommend at least you should go for this video, watch it, and then think how much in a single video, watch how much you could retain and how much you understand. Then you will easily decide to go for this course and to select the MRCEM. If you are going to select the MRCEM, I would recommend just simply go for this course and follow the instruction, and you will easily able to go through this exam. Thank you very much.
Thank you, Doctor.
Okay, so let's start
question and answer.
Question and answer parts. So we have some questions here. Number one questions. So I think Dr. Nehal and Dr. Raiiq is with us. So let's discuss the questions which have already asked by some students. Okay. Here, first question, pediatric Dr. Kashif Guljar. Pediatric emergency medicine can be done after completing MRCEM. So Dr. Nehal have already answered yes. It can be done while in training program, while a training, higher specialty training. To get into the higher specialty training, one have to finish ST3, that means specialty training 3, SSCS and DREAM and MRCEM. Hope it answers. Okay, fine. So yes, we have already discussed, Dr. Raiiq have discussed, yes, after completing MRCEM, and you can choose the pathways, especially pediatric emergency medicine, intensive care medicine. So there are lots of options there. How
Let
many
me just
years? Yeah, please.
one more thing, actually. One can also become a pediatric emergency medicine doctor from the pediatric route. I don't know if there is anyone here who is interested in pediatrics, but if someone does general pediatrics first, they can still do pediatric emergency medicine as well. But it is more common to do it from an emergency medicine route. The opposite route is a bit more difficult because they're usually not used to that much trauma. They're more medical doctors than trauma. But it's possible as well.
Okay. So Dr. Abdullahil Baki, he asked how many Pearson VUE centers in Bangladesh and their locations. Actually, after receiving the mail from the Royal College of Emergency Medicine, they will give a link in your email, okay? And they will connect you to the Pearson UV Center. That means Pearson UV system. So after login to their account, you will see the centers located in Bangladesh. Actually now, how many centers, Joel, last time?
It's about by 14.
14 or 14? 14.
12
So
to 14.
12 to 14 centers now. Initially, the number was quite large. Initially, it was 40, 38, 35, because most of the institutes or most of the Pearson centers can't maintain the quality. So day by day, there are some objections from the student side. So they cut the Pearson centers. Now there are 14 standard centers in Bangladesh. Okay.
Dhaka and Chittagong.
Sorry?
Dhaka and Chittagong.
Dhaka and Chittagong. They're Pearson centers. Okay. So Dr. Sarwar asked the questions. Are there any opportunities to build career in traumatology after MRCEM? So Dr. Nehal.
Yes, I think I've already answered this question. So basically, traumatology or casualty, what is quite popular in the eastern part of the world, is incorporated in the emergency medicine in UK. So you are expected to see traumatology patients while you are in the emergency department. However, if anybody is quite interested to build up their career and to have passion about the major trauma situations, when I say major trauma, I'm talking about the polytrauma cases, could be RTC, could be fall from above, could be stabbing patient, like acutely, very acute terminal patient from any trauma. So we don't have any defined pathways in UK at this point, but the expectation is they can do their training, they can do post CCT or like after finishing their training, they can do some fellowship in some of the recognized trauma centers. The other options are like somebody might think like, well, I would like to do some trauma experience before joining the training program, or might have a different pathway. Yes, they can get a job in any of the major trauma centers and get some fellowships and training over there. So it's not very clear cut, but generally expectation is when somebody is doing emergency medicine, they will deal most of the traumas.
I think it's also important to clarify from the questioner, what do they mean by traumatology? Because if they mean as in trauma from an orthopedics point of view, that's a completely different subject. So trauma from an emergency medicine point of view is a bit more holistic. It looks at both the medical and the injury side of trauma and managing the polytrauma patient initially. So if someone wants to actually do operation on a trauma patient, we do not necessarily do that. We do lots of procedures on them, but we are not surgeons.
Yes, so they have to choose the MRCS pathway. So it should be more, yes, it should be more convenient for him to get the FRCS even in any specialties. Okay, so better to choose if you want to build your career in orthopedics. So better to choose MRCS pathways. It will be better for you. Okay, another question is
the word traumatology has different meaning in different contexts.
Yes,
that's the problem.
Yes. Well, I completely agree with Raiiq, and I think with Raiiq was explaining that what should young doctor do, like a PLAB versus MRCEM or any kind of membership exams. I think like he explained everything, and many times what happened like that, sitting in one country and imagining something about other country is completely different. So probably you might have expectation of trauma and orthopedics in UK in an imaginary world, but when you come to UK or any of the other countries, you might find out the practice is completely different. So I think like it's always very important to have like a wide set of understanding, or like at least a wide mind. Well, I'll see how things work. If that suits me, yes, I'll carry on. If that doesn't suit me, yes, I'll have a plan B.
Yes. Excellent. Thank you very much. I think Dr. Sarwar, sorry, Dr. Who's the doctor? Okay, I missed his name.
Dr. Fahim.
Dr. Fahim.
I have been working in cardiology in United Hospitals for almost 2 years. I have experience in dealing with cardiac emergencies. Will that count as experience for MRCEM-UK?
Yes, any emergencies. Say, for example, you're working in cardiac emergencies. So yes, it will be accepted. But I think that sole cardiac emergency, better to show it emergencies. Okay, I think the Royal College will not dig it more. Initially, they don't dig it more. But if they want more, then you can submit the certificates from your hospital. Yes, I have dealt with cardiac emergencies, as well as I've experienced in emergency medicine too. Okay. And one thing is, yes, please.
I have a question, Asif bhai. It's
Yes.
probably towards you. So the question is like, because obviously I don't have any experience giving the member or any of the exams sitting down in Bangladesh on talking about the emergency medicine exams. Well, while I was giving MRCS exam, I mean like, well, the expectation is, yes, you need to have few years of training. However, Royal College of Surgeons of England didn't ask me any documentation to be given there. They just asked like, what is your experience? I said, well, when I worked in this hospital, that hospital. I don't think they even cared, honestly speaking. Because
honestly speaking,
should they care, they would have asked like they could say like ask them.
Yes,
Regarding
but one
emergency medicine, what is the situation? What happens when you apply? Because the thing is like certainly because we don't have any registered emergency medicine department in Bangladesh, so it will be tricky for any junior doctors who are applying these OSCE exams from Bangladesh, or even I think Pakistan. They're changing, but the situation is mostly like us. So what is the situation? And you did it, so what is your, I mean, what happens actually?
So one thing is important here. In Bangladesh, there is no FRCEM completed doctors or FRCEM completed consultants. Even I'm the first MRCEM completed consultant in government sector. So problem is there here that we have no classified department like sole emergency department. Even I have 4 years core training in emergency in internal medicine from Dhaka Medical and Surat Medical. So I have submitted that certificates. Yes, they accepted because I have told them, I mailed them. Yes, there is no emergency, but from internal medicine, we have to admit the patient, we have to receive the patient, any acute illness. Yes, they accepted. Another thing is, if anyone from Bangladesh needs any cooperation regarding, if, say, for example, Royal College ask you or give you challenges, so we need certificates, we need training under any MRCEM completed consultant or FRCEM completed consultant, here Dr. Nehal will cooperate you, myself will cooperate you, no worries. So if you work with me, if you work with me in any private ICU, private emergency, yes, I have the right to certify you, no worries, you can give the exam. And another thing is that, say, for example, you're working, I have told this earlier, you're working in a private hospital, there is a small room, emergency, just take a certificate from the director of that clinic. Yes, he has the capability or he have the competency to work there as an emergency physician. That's enough. Okay.
I think
Royal
that means
College,
you're trying to tell that the junior doctors who is focusing for MRCEM or emergency medicine pathway, they should be very proactive when they are doing the initial bits of job or training, whichever specialty it is, to get some training certificates or get some experience in some kind of emergency department and get some
yes,
certificates so that
obviously.
when they go for the exam, maybe 2-3 years down time, they have some evidence to show. Second
Yes,
question
they
for
have
you is, did the Royal College ask you to submit any certificates, or it was you
No,
yourself who submitted a certificate?
no. Royal College didn't ask me, but day by day, Royal College, I think they become a little bit, I don't know.
Little bit hard.
Yes, harder.
I don't think they will become hard. At the end of the day, Royal College's biggest source of income is exams. Okay, I'm
Yes.
being very, very cynical. I'm being very cynical. At the end of the day, they want people to give exams. Okay, there's their very biggest.
Yeah.
And they've not opened, if they've not opened centers in India and Malaysia to leave them empty. They want people to give the exam.
Yes.
So they want a nominal 6-month experience for the OSCE, which I think they will take it anyway.
Yes.
So they might, just for the sake of being prudent, maybe out of 100 cases they will probe about 4 or 5 people. If you're unfortunate, they might ask a bit more. Where did you do? What did you do? But it will be only a few people. For majority of people, you'll just breeze through. You just give your 6 months of experience, whatever experience you have, and then they allow you to pass give exams.
No worries. Yes.
Yeah, because in our case, when I give MRCEM exam, I didn't need to provide any documentation or anything. Well, I was in training program, but it's still MRCEM was not mandatory when I gave the exam. So it was just like
I had a completely different experience. I had to give example that I did do up to ST3 in emergency medicine in the UK.
Well, might be some history before, I don't know. Sorry.
So I was asked to give, but they didn't make a big fuss of it.
Is it like you got an email from them and they asked like that to show some evidence or what?
No, it's in the application form itself. They say.
So you have to upload documents.
Not really a document. Yeah, you have to say what you have done, and then if they ask, you have to give documents afterwards.
I think like that when you have a RCEM website or RCEM account, you actually upload your regular where are you working now, and all your information are already in RCEM.
This is very much important.
So if you update it regularly, so RCEM already know what you're doing. They won't even ask you like anything else.
One thing is, another thing is important, very important here. There should be no training gap. Say, for example, from 2015 to 18, you were in somewhere. There is a huge gap from 19 to 2022. Then they will. At that time, you were working where? There may be questions. So just make a routine training. Okay. So for example, you're working in a clinic, just make the certificate, upload it in your account. That means in your portfolio, just enough. They will not further dig. They will not ask any further questions. Okay. If you're very much unfortunate, then only they can challenge you. Okay. This. Say for example, you give a clinic name, 10 years, 15 years, 20 years. Then they will ask you, okay, this is your certificate. Upload it in your account. Ablatun Clinic. In the website, there is no name like Ablatun. Then they may ask you, what is Ablatun Clinic? Would you please show me the certificate? So that's maybe the question. Okay.
Recently, students are facing problem with the OSCE application. Some of my familiar students have got rejected by the RCM recently for the India session.
Because there's a problem, because they don't know what is CCT, they don't know what is ST3. One of my students just make himself his ST5 equivalent. That's why Royal College rejected him, because because in his logic, he has completed 5 years training, so he's ST5. So ultimately his application was rejected. So don't make it just 1 year foundation training followed by 2 years experience, not more than that. So if you have any questions, we'll upload this video in our page, in our closed Facebook group, and even in our Telegram group also. Okay. Thank you very much. Thank you all.
Thank you so much. Thank you, everyone. Good night.